Hello, everybody. After understanding the concept of injury and sports injuries, it is now time to understand the classification of sports injuries. We all should recall what actually the injury is. Injury is any break or disruption in the continuity of a tissue in the human body is considered as an injury, and the injury in the sporting context is considered as sports injuries. So the injury happen during training, during competition and many other occasions. People participate in sports for several reasons, maybe for competition, maybe for health, maybe for fitness or even for recreation. So people engaging in physical activities, sports and any other allied activities can come across sports injuries. The classification of sports injuries is an important topic in sports medicine to understand and classify sports injuries. So, based on this classification, proper management can be taken and proper treatment can be suggested. So, let us now understand what are the different types of injuries classified under different heads. Sports injury on the basis of impact. So certain injuries are acute injuries and some injuries are chronic injuries. So injury for the first time due to twists, collisions and which happen suddenly are called acute injuries. So these injuries happen for the first time. These injuries may be due to twists, due to collision to objects like a goalpost or to an opponent or even to the teammate. So collisions are quite common and these injuries are called acute injuries. So these happen for the first time. And there are certain injuries which are chronic injuries and these are also called overuse injuries and caused due to day by day impact. So the impact is gradual, so it is not, these injuries do not happen at one shot. So the impact actually accumulates over a period of time on a particular body part and this may lead to a overuse injury or a chronic injury. So healing in acute injury is very fast. This we should always keep in our mind. But in chronic injury, the athlete approaches the doctor at a later stage and healing becomes very difficult. So we should not neglect any kind of injury. It might be an acute injury or a chronic injury. Both have to be given due importance, and always we should keep in our mind that the pain is a warning signal and never in sports we should continue with pain. Classification on the basis of damage of tissues. There are different types of tissues in the human body. We all know that. There are skin injuries, soft tissue injuries, joint injuries, and injury to bones. So, what are the skin injuries? So, skin is a largest organ of the human body and it encompasses the entire body. So, we know that this is an epithelial tissue with three layers. It has got the epidermis, which is the outermost layer, it has got the dermis, the middle layer, and the innermost layer, that is hypodermis. So injury to these layers are called skin injuries, and there are different injuries in this: abrasion, laceration, incision, punctured wounds, avulsion, frostbite, sunburn, blisters, callus, and fungal infection are some of the common sports injuries. These injuries are common to anybody, but those who are engaged in physical activities and sports will encounter more of such injuries. Next is the soft tissue injuries. There are other soft tissues in the body like tendons, ligaments, and many other soft tissues that can be found in the body. It may be a blood vessel, it may be a nerve, or any other soft tissue. So, what are the injuries that can happen to these soft tissues? One is contusion. Contusion is a minor injury as compared to other injuries like strain or a sprain. Strain can happen to a muscle or even it can happen to a tendon. So sprain, as we all know, it's an injury to the ligament. Next we have joint injuries. So human body consists of different types of joints. We all know that there are different joints in the body, and the freely movable joints are the synovial joints. So usually these injuries succumb to these joints succumb to injuries. So ligament tear is quite common. Ligament hold the bones within a joint. The ligaments hold two or more bones within a joint firmly. So when this joint is moved beyond the anatomical limitations, beyond when there is a abnormal movement in a joint, so there is a tear in the ligament. When there is an overstretch in the joint, there is a ligament tear. So this ligament tear can happen in the joints. And there is an injury to articular cartilage. The articular cartilage are nothing but the soft structures that are at the ends of a long bone. So when these articular cartilages are forced to work beyond the limitations, these injuries, this articular cartilage may get injured. And there are dislocations. Dislocation is nothing but displacement of the bones within a joint. So when the bones when they leave their normal place, and when they are forced to work beyond its limitations, and when the ends of the bones are displaced, such injuries are called dislocations. And next we have injury to bones. There are fractures. Fractures are common in sports injuries, and there are simple fractures and compound fractures. Simple fracture is the one in which the skin is intact, and the compound fracture is one in which the skin is broken and the broken ends are projecting outside. And there is contusion. Contusion is a mild injury. It is a minor injury in which the structures get crushed by the external impact. Next is the classification on the basis of involvement of skin. So when the skin is torn, it is called open injury or exposed injury. Most of the skin injuries are actually open injuries, in which the continuity of the skin is lost. And during some compound fracture, even in certain conditions, the skin is broken and the bones are projecting outside. Next is the closed injury or unexposed injury. Strain, sprain, simple fracture, dislocation are some of the closed injuries in which the skin above the injury site is intact, but still there is damage to the tissues inside the or below the skin. So such type of injuries are called closed injury or unexposed injury. We should not mistake it as a minor injury. Rather, when even if the skin is intact, there may be some major injuries within. Next type of injury is on the basis of occurrence. So there are primary injuries which occur for the first time. The blow is for the first time on a fresh body part. Such injuries are called minor injuries. And there are certain injuries that are secondary injuries, in which there is already an impact, already there is a injury. Either there is healing done, or there is partial healing, or there is no healing. And again, if that particular body part is impacted by an external force, then such injuries are called repetitive injuries. Especially these injuries occur in the ankle. So once it is recovered, when the ankle sprain is recovered, but still there may be recurrent injuries to the same body part. Such injuries are called secondary injuries. So another type of classification is on the basis of cause. So the cause may be direct impact, or an indirect impact, or an overuse injury. So direct impact, as we all know, a body part getting a blow from external object, or from an opponent, or from a partner. So when there is a collision or when there is a hit, such injuries occur. In indirect injuries, the impact is not directly on the body part. Rather, it is on a different body part, and the impact is transferred to some other body part. Such injuries are called indirect injuries. The best example for this is the countercube fracture occurring in the skull. Next is the overuse injuries. As I already mentioned, these injuries occur over a period of time. These injuries don't occur due to a single impact. Rather, when a body part is used, there is micro trauma, and if the proper rest and healing is not ensured, then such body part gets injury again and again, a micro trauma again and again, and a stage will come when the athlete has to stop the activity, wherein he cannot continue with that particular injured site. So these injuries are called overuse injuries. So we have come across different types of injuries, and this information is very useful in the management and treatment of sports injuries. Thank you very much for your patient listening.